Portuguese have their vices like anyone else, but if their health deteriorates, they know, like most Europeans, there's a high-quality yet mainly free healthcare system to look after them. But big spending cuts were a condition of the country's recent bailout. Hospitals are cutting salaries and getting rid of staff. People have to pay more to see their doctor. As a minister, António Arnaud helped set up Portugal's health service after the fall of the dictatorship in the 1970s. He's now a lawyer in Coimbra, north of Lisbon, and he's angry at the cuts.
I'm worried about the future of the national health system, but not because of the economic difficulties that Portugal is now experiencing. My main concerns are about this right-wing government. There's an ideological project to destroy the national health system.
The Portuguese have benefited greatly from Arnaud's creation. 40 years ago, 1 in 20 Portuguese children didn't survive infancy. Now it's only 1 in 300. General life expectancy has increased by 12 years over the same period. What will happen to this success story, though, when €1 billion gets shoved off the €7.5 billion health budget? Professor Pedro Barros at Nova Business School in Lisbon isn't overly pessimistic. He says 2/3 of the savings will be achieved by reducing drug prices and from staff wage cuts, so the effect on services will be limited.
I think that people want a free health service the way it is, funded by government and mostly free at the point of use. Yes, the discussion is on how people provide healthcare, whether it's going to be the private parties helping more and provide it, also including non-profit.
Private health providers here have started running hospitals on behalf of the government. The country has a thriving private sector already. This clinic is one of the biggest providers of facial surgery in the world. Dental care is not covered by the state. And the boss of the clinic, Paulo Malo, says Portugal's financial difficulties mean more people should pay.
We should not have a universal health care that will give health care to anybody that will come to a public hospital. Only the people in need or below a certain income should benefit from this. So that's the main change, and that change will happen. It's not a question if you like it or not like it, that will happen.
Paulo Malo may have expanded this business all over the world, but Portugal's overall economy is in its worst recession since the 1970s. If the country has to continue cutting government spending for years to come, perhaps a system almost all of the country still holds dear will have to be slimmed down. Dominic Laurie for VOA News, Lisbon.